He wasn't a stent helping and experience.
We talked just real briefly about arteries and veins, and really we just said one thing about them, is the direction in which they carry blood. So arteries carry the blood away from the heart, veins carry the blood back to the heart. But there are other differences in them.
You know?
And there's a third type of blood vessel we haven't really mentioned called capillaries. So if you were able to just take every single blood vessel from a human and sort of line them all up, it would be about 60,000 miles long in your body. So that's pretty amazing. And the reason that it can be so long is because they're very, very tiny, most of these blood vessels, and they basically are surrounded, all of your cells are surrounded by these tiny, tiny blood vessels. All right, so let's talk about them one at a time. Arteries, first of all. As you guys know, arteries are the blood vessels that carry blood away from your heart. Okay, so they lead away from your heart to various places. And it's easy to remember because the A in artery goes with away. Most arteries carry oxygenated blood. Again, they're leaving the heart. They're going to all the various spots in your body, so the blood they're carrying is usually high in oxygen. The only exception to that is this pulmonary artery, because it's the artery that's bringing the blood to the lungs. It's carrying deoxygenated blood. Arteries are stretchy. You say they're elastic. And that's important because when your heart beats, your ventricles pump blood into your arteries. And that blood is under pretty high pressure. And so your arteries that are holding that blood have to be able to withstand that pressure. And every time your heart beats and pumps blood into those arteries, they expand, they swell, and then they come back to their normal shape. Every time your heart beats, they swell. And you can actually feel that. What do we call it when you feel your arteries expanding on every heartbeat? There's a word for it. I know you've heard it, but you may not have exactly known what it is.
A pulse.
Your pulse. So if you put two fingers on the left side of your neck and slide them towards your throat, there's this little indentation here before you get to your throat. If you press into that indentation a little bit and you feel, can you feel your pulse there?
Yeah.
What you're really touching is underneath your fingers there is your carotid artery. It's carrying the blood from your heart up into your brain and your head. And every time your heart beats, that artery is swelling. And so that's what you feel when you feel your pulse. You're feeling an artery swelling each time. So they're strong, they're elastic, they're smooth on the inside, hopefully, so that blood can flow smoothly and quickly through those blood vessels. They start off very large. What's the largest artery called? This one? What? The aorta. It's this big. It's pretty big around, maybe about that big around. As it starts branching off, the aorta branch off. One branch goes up to your brain. One goes down towards your right arm. One goes down to your left arm. One goes behind your heart, down to your torso. One artery goes down each leg. As the blood continues through those arteries, it continually branches off to reach all the parts of your body. Every time it branches off, it gets smaller. Okay? So the arteries get smaller, kind of like branches on a tree. You have the trunk of a tree, and every time the tree sort of splits off to send another branch, you get thinner and thinner until you have the thinnest branches at the very end. Same kind of thing is true of the arteries. They branch off, getting smaller and smaller and smaller to reach every single part of your body. They're made of muscle, smooth muscle on the inside. And they carry the blood away from your body, getting smaller and smaller and smaller until they get so narrow and so small that only one single red blood cell at a time can actually fit through them. And when they get that small, we start calling them something else. Start calling them capillaries. Capillaries are these super, super tiny, thin blood vessels. They're just a single cell thick. And these are the blood vessels where things move in and out of our blood. Because they're so thin, material can easily diffuse into our blood and out of our blood. If you think about this, right now, as your heart is beating, arteries are carrying blood up to your brain, into capillaries that surround your brain cells. What is your blood giving to your brain cells? There's a couple things. What is your blood giving to your brain cells? What did you say, Sophia? Did you say something? Yeah? Oxygen. Every cell must have oxygen at all times. And so your blood's giving your body cells, your brain cells, oxygen. They're also giving your brain cells other things. What other things does your blood supply to your body? Nutrients. Glucose and vitamins, minerals, okay? Water, all sorts of different things. That's supplied to your cells by your blood. At the same time as your blood gives your cells those things, it's also taking stuff away from your cells. What do you think your blood takes away from your cells? Waste products, especially carbon dioxide, nitrogen waste. Those are produced in our cells, but if they build up, they become poisonous, toxic. So our blood takes them away from our body cells to help get rid of them. So all this movement of things back and forth happens in these capillaries. The capillaries are so narrow, one red blood cell at a time has to fit through. They sort of go single file. And along the way, they give up oxygen. They give up nutrients. They take in carbon dioxide. They take in waste products. So, our arteries were going away from our heart. They went to all the parts of our body. They became so thin, we start calling them capillaries. So, leading into this capillary was an artery. After the capillary, where's this blood headed now that it gave up oxygen? It turns into a vein. And where's that blood going? Back to the heart again. Then where's it going to go after the heart? To the lungs. Then where's it going to go from the lungs? Back to the heart, then to all the parts of the body again. Repeat that over and over again. That's how our circulation works. Okay, so after the capillary, this blood has to get back to our heart. It goes through another blood vessel called veins. Veins bring the blood back to the heart. The structure of veins is a little bit different from the arteries. Almost every vein carries deoxygenated blood. And again, as we talked about in our question of the day, except for the pulmonary vein. That's the one that carries oxygenated blood from our lungs back to our heart. Now, the arteries had very high pressure in them because they directly connect to the heart, and as the heart pumps, it forces blood into the arteries. So there's high pressure in arteries. In veins, there's much lower pressure because the blood's already gone through all the capillaries. It's headed back to the heart. So because of that, veins have a special structure called valves, little sort of one-way doors. So this is headed back to the heart, and these valves along the way allow blood to go this way, but if the blood tried to go backwards when there was lower pressure, this valve stops it. So these valves help make sure blood's only going back to the heart. Arteries don't have those because they don't need those. In arteries, the pressure of the heart is forcing the blood this way. In the valves, there's lower pressure, so those valves help prevent it from going backwards. So if we sort of look at an overall diagram here, we have arteries that came away from the heart, connected to this capillary network, which surrounds all of the cells of our body, and eventually they lead back into veins, which can take the blood back to the heart. So here we have a diagram of that. We're going to label some parts. This is an important diagram to understand. This exact diagram basically is going to be on your quiz. All right, so this is capillary network. In this diagram, blood's going this way, from left to right. So what is this type of blood vessel? What would you call this? Which one? That's an artery. It's coming away from the heart. Okay, that's an artery. What do we call this whole blood vessel? Capillary. And then when it comes back together, that's a vein. Okay, so we have artery, a capillary, and a vein. They're all interconnected though. Arteries turn into capillaries, which turn into veins. So what do you think these blobs represent? Eva? No? Cells from our body. Yeah, these are, we say body cells. Maybe they're cells in your bicep muscle. Maybe they're cells in your eye or your stomach. Maybe they're cells in your brain. Okay? So they're cells somewhere in your body. These are also cells. Raise your hand if you could tell me, what type of cells are those little circles? Ava?
Red blood cells?
Yeah, they're red blood cells. We abbreviate RBC lots of times. Those are red blood cells. And you'll notice in the capillary, they're moving single file. That's how small the capillaries are. Now, this is something we haven't talked about yet. Now, our cells are not just surrounded by like air. There's actually fluid in there, like liquid. Okay? And that liquid is a material we call lymph, our body fluids. And it sort of surrounds all of our cells, helping materials diffuse. So let's think about this. This number 6 is showing something moving. This arrow is showing something that's moving from a red blood cell into a body cell. What material? Yeah, that's oxygen. That's what our red blood cells do. They carry oxygen, and then they deliver it to our body cells, and that's what's happening here. Number 7. What's carrying these red blood cells? This sort of liquid. Okay? Yeah, that's plasma. Okay, that's the liquid part of our blood that carries the plasma, that carries the red blood cells around. 8. Now you might say, well, that looks just like number 6, but there's a little bit of a difference here. Do you know what the difference is? Why is 8 going to be different from 6? Sophia? No? Alex? No, that's not it. It's more about the other end of the arrow. So the arrow's not showing something moving from a red blood cell into our body cell. It's showing something moving from the plasma into our body cell. So what is our plasma carrying that it's going to be providing to our cells? So the red blood cells carry the oxygen. What's in the plasma? Angela? No, because that doesn't go into our body cells. Brandon? No? Nutrients. Maybe glucose or vitamins or minerals. That's nutrients. Those nutrients are in the plasma, and they diffuse into our body cells. Oxygen is carried on the red blood cell. Then we have one last thing. So something's going the other way. It's going from our body cells into our blood. So what's going that way, Jenna? The oxygen. Well, this blood is the oxygen, but that's not the substance. Ethan? Waste. Could be carbon dioxide, could be nitrogen waste. They are going from our body cell so that they don't build up and become toxic into our blood so that our blood can help get rid of it. All right. Now, I'm going to move past the next several slides. We'll come back to that maybe for review at some point, but it's just questions about this diagram. All right. Oh, wait, I want to show you this now. So this is what it actually looks like. This is under the microscope. So this is showing blood. It's coming from this lower left-hand corner going up this way. And you could see, so if the blood's going this way, what is this? That's an artery. You can see it branching off. But if you look here or here, what does it become here? That's a capillary. You can see the blood cells inside of it going through. Look in the background. You see, what are all these things? Those are cells. Maybe they're brain cells. Here's another capillary. And so along the way, these red blood cells are giving these other cells oxygen. The plasma is giving those cells the nutrients. At the same time, these cells are giving to the blood the waste products to get rid of them. Brandon?
What are these tiny lines in the background?
I don't know. They're just, I'm not sure what they are. I don't even know what kind of tissue that came from that slide. This is from the bodies exhibit. And in these bodies, what they've done is they've taken away basically everything except for the capillaries. So obviously, you can see in these pictures, where do we have capillaries? Everywhere. Our whole body is surrounded by these capillaries. Okay? All of our tissue, because all parts of our body need oxygen. They need those nutrients. And so when we said in the beginning, 60,000 miles, if men take all those tiny, tiny little blood vessels and arrange them, there's a lot in there. All right, I'm going to skip all this, so don't worry about it. Our last topic for today is about heart disease. What? So this is cardiovascular disease or heart disease is very important. Heart disease is the leading cause of death for people in the United States. Okay? 25% of all people that die in the United States have died from cardiovascular disease, heart disease. So it's obviously really important. Most of that is due to coronary heart disease. So this is our heart. And what is the heart made out of? What? Somebody said it. What's it made out of? Muscle. It's a muscle. And like all muscle, just like your bicep muscle, it needs a constant supply of oxygen in order to work. Now your heart's a little different from other muscles because it never tires out. You know, if you do some curls, eventually, okay, your muscles get tired, you can't do anymore. That would happen after just a few minutes. Your heart beats every single second, basically, and never gets tired. So it needs a supply of oxygen, is very important to it. So you might think, well, it's filled up with blood, that's where it must get its oxygen, but it doesn't. Okay, it doesn't get oxygen from the blood inside of it. The heart has its own arteries and capillaries that surround it, and they are what supply the blood, the heart muscle itself, with blood, with oxygen, with nutrients. And those coronary, they're called the coronary arteries. You see them, this picture is the heart without the heart. These are just the coronary arteries and capillaries surrounding the heart. Okay. And so they are the blood vessels that give oxygen to the heart muscle itself. And so if these arteries are not working properly, the heart doesn't have a supply of blood, and that is very bad. If your heart loses its blood supply, basically it can't work anymore. The heart muscle starts to die, and the heart doesn't work, can't pump blood to the rest of your body, and then the rest of your body can't survive without that supply of blood. So the coronary arteries are very important. But what happens to the coronary arteries sometimes? I think you've learned in health a little bit about this. Alex? They can become blocked. They can become sort of clogged up. Okay? The thickening of arteries and the clogging of arteries is a disease called atherosclerosis. And what happens is there are certain substances in our body, like cholesterol, a fatty substance. Our bodies make some cholesterol on their own, just a natural part of what our bodies do, and we need cholesterol. However, if we have too much of this fatty cholesterol in our blood, it can start to collect inside our arteries, and that's bad. Where do we get cholesterol besides our body making it? Yeah?
From food.
Yeah, from foods that we eat. Foods that contain animal products. Cholesterol is an animal product, so it's in cheese and meat and milk and butter and things like that. And so if these arteries that are giving our heart blood, if they get clogged, that can result in a heart attack. Okay? Now, sometimes starts off as just pain in the chest, because your heart muscles being sort of starved for oxygen, it starts to hurt oftentimes. That's called angina, is the name for that, chest pain. When it gets really bad, it can be completely blocked, and that can lead to what we call a heart attack. Heart attack is when the heart stops working, often because of a blockage in a coronary artery. So you see, here's a normal artery, nice and smooth on the inside, blood can easily flow through it, but as it gets sort of clogged up with this fatty plaque, this cholesterol, it's much harder for blood to get through there. It can eventually be completely blocked, and then no blood can get there, and that's a bad thing. So there are lots of different risk factors that could lead to this coronary heart disease. Things like obesity, diabetes, smoking, okay? High cholesterol, high blood pressure. All of those are risk factors. There also are genetic risk factors that some people just in their DNA, because of the genes they inherit from their parents, they are at a higher risk of developing coronary heart disease. I once knew a teacher when I first started teaching here. He had very high cholesterol, and it was in his family, but he ate extremely healthy. Like every day he just ate a piece of fruit and crackers, and he ate very healthy, but still he had high cholesterol. Even eating a very healthy diet, it was just something that his body did. It made cholesterol at higher levels. You get tested for your cholesterol levels. Like if you ever have a blood test, they'll check your cholesterol levels to see if they're in the proper range. You can improve your cholesterol and the health of your arteries by exercising, by eating properly, doing things like that as well. But some people have blockages in their coronary arteries that need to be fixed. There's a few things doctors do when a person has blockages in their coronary arteries. One of the first things they might do is a process called angioplasty, which is kind of interesting. In angioplasty, they take what's called a catheter, a little metal wire basically, and they insert it into an artery in your body. Often they go in the groin. So this is your femoral artery. Like your main arteries from your aorta loops down through your torso, and then one goes down each leg. These femoral arteries are right in your, sort of go down each leg, and they're accessible there in your hip joint. So they take this wire, they insert it into your artery in your hip, and then they start working it up through those arteries all the way up into your heart. They can guide the wire. Okay? And they get it up into your coronary arteries, like this. You can see they loop it into the aorta and then in the arteries. And then they can do several things. They can inject a dye that they then make an image of your arteries, and they can see actually where there's a blockage. They can also then do this process called balloon angioplasty. What they do is they get the wire to the blockage, like you see here. See the plaque built up on the side? And then at the end of the wire, they have a little balloon that they inflate. And that balloon inflates and basically smushes this plaque against the walls of the artery and opens up the passageway. So if you have like a blockage like that, you know, this is maybe 50% blocked. So blood is still going through, but it's kind of difficult for it to get through. The heart may not have the best supply of oxygen. They might do this. And it might stay open for a while, but it might not. The other thing they can do is put in what's called a stent. Has anyone ever heard of a stent? Basically, it's like a reinforcement. So they do the same kind of thing. They get the catheter in the blockage, they inflate the balloon, but then they also have in there this little metal cylinder sort of thing, a mesh cylinder. They inflate it, it expands, and then it stays in the artery. They take the balloon out, and this little reinforcement kind of keeps the artery open and makes it less likely to close up again. Often they're medicated so that plaques won't stick to them. And so that's a stent that can keep it open for a longer period of time. And so that's another procedure. Sometimes that doesn't work though. There's another picture of the stent. And so if that doesn't work, a person might have to have bypass surgery. Have you heard of bypass surgery? So in bypass surgery, let's look at this heart. So this is a person's heart. Here's one artery, coronary artery, that feeds their heart blood. Here's another one. But in this case, there's two blockages. There's a blockage here and a blockage here. So the blood that's coming from the aorta is getting to this point, and it can't get further. Or it's blocked and only a little bit of blood is coming down here to these parts of the heart. Same thing on this side. Here, this blockage is preventing the proper amount of blood from coming down here. So they would try probably balloon angioplasty, they'd probably try a stent, but if it doesn't get it open, they need to take a more drastic type of procedure. And that's a bypass surgery. Now traditionally in bypass surgery, it's open heart surgery. Person goes under anesthesia, they stop their heart from beating, they attach them to a heart and lung machine, which basically takes over for their heart and their lungs. Puts oxygen in their blood, pumps blood around their body so they stay alive, but their heart is stopped. And then they have to open up their chest cavity. And so to do that, they have to, so what protects your heart? Your sternum and your ribs. So to actually work on the heart and do open heart surgery, they have to make an incision through your skin, through your pectoral muscles, and then they have to saw through your sternum. And then they open up your chest cavity with a tool called a rib spreader. They open it up so they can access your heart and actually do the surgery. And what they do is sometimes they take a vein from your leg, and they basically cut it out of your leg, and then they put it in here. They attach one end to your aorta and the other end to this coronary artery. So once they've done that, blood that's going into the aorta, some of it comes through this new vein that they added, and it goes around. It like takes a detour around the blockage to supply this part of the heart with the blood. So they go around, that's why it's called bypass. It's going around the blockage. The other thing they can do is there's an artery in your chest that's already connected here, okay, to your arteries. They cut it off from your chest and they attach it here to the coronary artery. And again, blood comes up, goes through this, gets around the blockage to supply the heart with blood. But this type of surgery is like a major surgery. They have to stop your heart, cut you open, cut through this bone. After you go through surgery, you're in an intensive care unit. You need to stay in the hospital for a long period of time. It's a very slow and long recovery to recover from it. Okay? Well, that's the rib spreader that opens up your chest cavity. That's kind of what it looks like. The next one is it's a picture. So if you don't like the pictures, don't look. This is showing, it's kind of hard to see. They have the rib spreader in and open. Here's a person's heart. They're doing the surgery to do the bypass.
Is that like an actual picture?
Yeah, that's an actual picture. Now there are more modern techniques of doing surgery, including bypass surgery, using robotic surgery. So using this type of surgery, this is the doctor. They sit at this console and control the arms of this robot. And what they can do in this type of surgery is rather than cut open your whole chest, just hold on one second. You don't have notes, but just listen for a second. So instead of cutting open your whole chest and breaking your sternum, they actually just make several kind of small incisions, and these arms of the robot go into your body. They can get your heart underneath your ribs and through the gaps in your ribs, and the doctor can control these arms, do the surgery without cutting it all the way open. And you have to stay in the hospital for a lot shorter period of time, and the recovery is much easier. I got to use one of these robots. They brought one to the high school once, and I went down there to use it. Not on a person, but you could like control the arms and see how it works and do little things. It's kind of neat. All right, we'll talk about blood type tomorrow to finish up this section.